for instance, why isn't the FDA making drug companies study psychiatric medications for longer than 3 months? We know these are drugs that people become tolerant to. We know they're drugs that 1 in 8 people take, in the US for several years at a time. And I mean, there's absolutely no leadership there. And it's not like that's like the cap, because we study statins for high cholesterol. We put people in randomized controlled trials for 3 to 5 years. And so there's no leadership at the FDA saying, hey, guys, we're going to make you guys do a 2-year clinical trial so we can really get to the bottom of what antidepressants are doing long term. And, they don't do it essentially because of precedent. The first antidepressant came through with 3 months, and now I guess that decision, everyone just looks at that decision making and just says, okay, well, we did it that time, we did it that way, and so we're just going to go with that. And we don't want to say that, I guess, the old director of the division who said that was okay had poor judgment, and so they're just going with the flow. I mean, they're not really working with industry in a way that's making drugs safe. I think they're just doing what's easy for them.
Well, I feel like that is a very positive or an optimistic way of looking at it. Again, coming from what I have learned over the last several years in our fight, I call it a fight in the courts of law, is I feel like, the example of statins speaks for itself. So if there are drugs that they do multi-year clinical trials of, and then there are certain drugs that they simply refuse or don't suggest that maybe we should extend the trial periods, even just 1 year, even just 9 months. To me, it seems intentional, especially when I see, as a lawyer, the laws that are in place to just minimize liability to pharmaceutical companies and manufacturers and administrators and distributors. To me, from my cynical legal perspective, when you put all the pieces together, it seems much more intentional and calculated to avoid liability, which we've seen consistently since basically the mid-'80s.
I think you're onto something. It definitely is intentional from the part of the pharmaceutical industry. Their job, especially leadership, is, hey, just get the drug on the market. And if FDA says do this trial longer, they'll get their lawyers to say, hey, but you just didn't make so-and-so do it longer. So why are you going to make us do it? And yeah, we know so little about what antidepressants do. Everyone's always saying, hey, they're the most studied drugs of all time, but we've essentially run the exact same clinical trial thousands of times, right? The same 3-month thing, rather than doing multi-year or better studies. And yeah, that is intentional. They just want to walk a well-trod path to getting onto the market, and then they want to crank up the marketing and sell it as much as they can.